Hello, my name is Jessica Arrington. I'm an environmental health specialist from the University of Arkansas for Medical Sciences, here to speak with your high school class about common exposures and injuries affecting children, especially since many of you are interested in pursuing careers as pediatricians. Compared to adults, children's bodies are still developing, making them especially vulnerable to environmental hazards and injuries. First, their brains and lungs are not fully developed, which makes them more sensitive to air pollutants and toxic exposures. This underdevelopment can lead to more serious long-term health impacts from the same level of exposure that might be less harmful to adults. Second, children's skin is thinner than that of adults, so when they experience burns, the damage can be deeper and more severe. Additionally, children's smaller body size and developing systems mean that they can easily absorb higher levels of toxins and lead and household poisonings. Even small exposures can lead to significant harm in children compared to adults. Children often have limited swimming ability and lack knowledge of water safety, making them more likely to drown if they are left alone. Children also face increased risks due to limited understanding of danger. They are less likely to recognize harmful objects or situations, whether it's ingesting something poisonous or not knowing if they are in an unsafe situation. All of these factors combined highlight the importance of why injury and exposure prevention efforts must be focused on children's unique characteristics. This figure shows some of the anatomical differences between children and adults mentioned in the previous slide. Children have a higher respiratory rate, thinner skin, higher metabolic rate, and an immature immune system, rapidly dividing cells, a larger body surface area, and an immature blood-brain barrier. These differences can be affected by various types of injuries that may not affect the adult population in the same manner. It is important to understand these differences when considering exposures and injuries in the pediatric population. Air pollution is one of the top health threats for children. It's the second leading risk factor for death in kids under 5. When children inhale polluted air, it can lead to asthma, respiratory infections, and even slowed brain development because their lungs and brain are still growing. To help prevent these effects, pediatricians should assess kids' exposure risks both indoors and outdoors. That means asking questions about the children's environment, such as asking if they live in areas with wildfires, factories, dust storms, or smoke. In order to prevent children's risk of exposure, families should improve indoor air quality with air purifiers or HVAC filters. Also, on days with a high air quality index, it's best to keep children indoors to limit their exposure to pollution. Lead exposure can be very dangerous for children and often happens through contaminated soil, old paint, or drinking water. There is no safe level of lead exposure in children. Even small amounts can affect development, but high levels can cause irreversible brain damage. And in the most severe cases, it can lead to seizures, coma, or even death. Children are especially at risk because they often put their hands or toys in their mouths, which increases their chance of ingesting lead from their environment. To help prevent exposures, it's important for parents to wash children's hands and toys regularly, especially after playing outside. Additionally, testing can be done to determine levels of lead in their environment. This graph shows the 15 leading causes of death among children 1 through age 14. Accidents, unintentional injuries, are the most leading cause of death in children 1 through 14. This graph shows the importance of preventing injuries among the pediatric population. The following slides involve injuries that can be highly preventable through safety measures. This table was taken from an article from the American Family Physician Journal and shows many strategies to prevent unintentionally childhood injury. While we are not going to go in depth into all of these types of injuries today, I would like to briefly highlight some from this table and then go in more depth on others. Bicycling injuries can affect children of all ages. Preventative strategies include wearing helmets while riding the bike and checking the bike's part regularly to ensure it's functioning correctly and safely. Falls affect infants and toddlers and have a very broad range of injury. Children can fall off of playground equipment, chairs, downstairs, or out of cars. For prevention, children should be educated to not climb on certain objects. Additionally, caregivers should use safety gates and preferably have carpeted stairs. Gun injuries affect toddlers and teenagers and can be prevented by storing unloaded guns in a locked area, such as a gun safe. Motor vehicle crashes can affect children of all ages and can be prevented with appropriate car seats for their age and size. Additionally, children who are 13 or younger should not ride in the front seat of vehicles. Drowning is one of the most preventable injuries among young children. Two common sources of risk are unsecured pools and unsupervised baths. Children ages 0 to 4 years have the highest drowning rates of any age group. This is largely due to their inability to recognize danger around water and limited ability to swim. Drownings can happen very quickly and quietly, which is why consistent supervision is very important. There are several effective prevention strategies. First, install fencing or nets around pools. This method reduces drowning risks by preventing unsupervised access. Second, caregivers should always supervise young children around water, whether it's a pool, bathtub, or large body of water. Third, it's important to teach children basic swimming and water safety skills as early as possible. Parents can enroll young children in swimming classes to learn how to float or turn onto their back in the water. Accidental poisoning is another cause of injury in children, especially in young children who like to put things in their mouth and are unaware of harmful substances. Common sources of poisoning include medications, either due to incorrect dosing or children accidentally ingesting them, cleaning agents like bleach and laundry detergent pods, and other household items such as alcohol, glue, or even batteries. These substances can be extremely dangerous. Even small amounts can lead to serious harm, including chemical burns, seizures, or organ damage. However, these injuries can be very preventable. Caregivers should first always store poisonous agents out of children's reach, ideally in high cabinets. They should use child locks on cabinets and drawers, especially those that contain medications or cleaning supplies. And also, they should never transfer the substances to other containers like food or drink bottles. This increases the risk of a child mistaking a harmful chemical for something that is safe to eat or drink. Another preventable type of injury affecting children is unsafe sleep environments. Sudden and unexplained infant death syndrome, or SUID, which includes sudden infant death syndrome, SIDS, is the leading cause of death in babies between 1 month and 1 year old. SUID often occurs during sleep and usually shows no warning signs. While the exact cause isn't fully understood, creating a safe sleep space can drastically reduce the risk. A great acronym for educating others about safe sleep is the ABCs of safe sleep. A is for alone. Babies should always sleep alone in their own crib. Although many parents prefer bed sharing, it significantly increases the risk of suffocation for the baby. B is for back. Babies should always be placed on their back to sleep. This position allows for their airway to be open and not obstructed. C is for clear crib. The crib should be completely free of loose blankets, pillows, and toys. These items can obstruct a baby's breathing. Another type of injury is burns. Younger children are more at risk for scald burns. This happens when they come into contact with hot liquid, such as hot bath water or hot drinks like coffee. Older children are more likely to get flame burns from items like candles or campfires. Other common causes of burns include electrical injuries from electrical outlets and fireworks. To prevent these injuries, caregivers should ensure many safety measures are in place. They should always check the water temperature before bathing a child to avoid scalds. When cooking, caregivers should use the back burners on the stove instead of the front ones to keep hot pots out of reach. Also, caregivers should ensure that cords from hot appliances are out of reach from children. Finally, children should not handle fireworks to prevent painful burns from occurring. Since many of you are interested in becoming pediatricians, I will discuss what it takes to become one, what the many roles of pediatricians are, and what roles pediatricians take in preventing exposures and injuries. To become a pediatrician, you'll need to complete about 11 years of education after high school. First, you'll go to college for 4 years and earn a bachelor's degree. You can choose any major, but many pre-med students choose science majors like biology or chemistry. And during college, you'll also need to take the MCAT, which is the exam required for medical school. And you'll also need to participate in extracurriculars like research or volunteering or working in a clinic. And after college, you'll attend medical school for another 4 years. The first 2 years focus on learning in the classroom about anatomy and different diseases. And then the last 2 years are clinical rotations where you work in hospitals and clinics in different specialties, including pediatric. And during this time, you'll take the USMLE test, which is a series of 3 national exams that are required to become a licensed doctor. So there's step 1, step 2, and step 3. And finally, you'll complete a 3-year pediatric residency. And so, from start to finish, becoming a pediatrician takes a lot of time, hard work, and dedication, but it can be very meaningful and very fulfilling work. The roles of a pediatrician can be very diverse and broad, and they can factor into every stage of child development from infant years to teenage years. Pediatricians perform wellness checkups throughout the child's life. They provide physical exams for school or sports. They can also track the child's development, including things like speech and skills and motor skills and behavior. They can prescribe medications and give vaccines, and they can diagnose and treat common illnesses like ear infections or strep throat. They can also manage chronic illnesses such as asthma. But two of the most important things pediatricians do are educate caregivers and families. They guide parents on what to expect as their child grows, and they provide preventative care, which means helping children to be healthy and prevent sickness or harm from occurring. Education and prevention are very important parts of pediatrics and can have lifelong impacts on a child's health. Additionally, they are very important for preventing injuries and exposures in children. One of the major roles of a pediatrician is preventing children from unintentional injuries and environmental exposures. Their roles involve clinical care, education, advocacy, and public health. They help to reduce common and preventable risks that threaten child health and safety. There are many different ways in which pediatricians can prevent injuries and exposures. The major way is parental education. They inform parents about risk of injury and discuss drowning prevention, poisoning prevention, burn prevention, and suffocation prevention. Pediatricians can also counsel families about sources of lead, such as peeling paint in old homes or contaminated water or soil. They can identify illnesses that are associated with air pollution, such as asthma, and advise families to use air purifiers in homes. Pediatricians can also encourage parents to install pool fences and to always supervise their children around water. They can counsel families on how to properly store cleaning agents and medications in locked cabinets, and they can recommend installing child-proof locks. Pediatricians can also encourage families to check water temperatures before baths and advise them to prevent children from being around fire or hot liquid. Additionally, they can inform parents about safe sleep. These are all some of the major preventative roles of a pediatrician. Pediatricians can also conduct environmental health screenings for their patients. They can screen for lead exposures and assess for air pollutants exposure. For example, they can ask about living near factories, living in old homes, or living in homes in which the water has not been checked for lead. Many pediatricians are community and state level advocates as well. They can propose legislation that helps prevent injuries and exposures from occurring in children. They can sponsor legislation with more regulations for lead-safe housing or advocate for clean air regulations around schools and neighborhoods. They can also support school funding opportunities through community-based programs about preventing harmful exposures and injuries in children. These are a list of my references. I hope this presentation was helpful to understand the many injuries and exposures that affect children and how being a pediatrician can greatly help in preventing these harmful events from ever occurring. Thank you.